My name is Jordan Kennedy, and today I will be giving a presentation on healthcare providers as allies to LGBTQ patients, the challenges and considerations. As stated, everyone needs healthcare. It doesn't matter a person's race, religion, or their sexual orientation. Um, Medicine is a constantly changing field, and there are still many issues that lie within healthcare. And one of the major issues that is in healthcare is providing proper treatment for the members of the LGBT community. The LGBTQ plus acronym stands for lesbian, gay, bisexual, transgender, and questioning. Mental Health America, only 4.5% of the U.S. population identifies as lesbian, gay, bisexual, or transgender. Many sexual minorities often experience improper medical care, resulting in the entire community experiencing the health disparity. The health disparity is defined by the Centers of Disease Control and Prevention as preventable differences in the burden of disease, injury, or violence, or opportunities to achieve optimal health that are experienced by socially disadvantaged populations. A survey showed that more than half LGBTQ plus members have been faced with providers denying them care, using harsh language, or blaming the patient's sexual orientation or gender identity as the cause for an illness. According to Mental Health America, although being LGBTQ plus is not a mental illness, the community is faced with oppression, making them subject to suffer from mental illness, physical violence, and or substance abuse. Mental Health America also states that in mental health care, stigma, lack of cultural sensitivity, and unconscious and conscious reluctance to address sexuality may also hamper effectiveness of care. The MHA also states that LGBTQ plus teens are 6 times more likely to experience symptoms of depression than non-LGBTQ plus identifying teens and are 4 times more likely to commit suicide. With many LGBTQ plus teens still being ostracized, they are forced to feel a sense of loneliness, which also can cause trauma. Also, with the um, health disparities and physical violence and abuse that they experience, it's a factor that plays into the mental health of the LGBTQ people. And according to the National Alliance on Mental Illness, trauma can come from discrimination, harassment, or assault, either a single event, such as getting assaulted for being LGBTQ or fired for a transphobic employer, or the long-term effects of sustained stress due to discrimination can lead to post-traumatic stress responses or PTSD. Healthcare providers that create a friendly environment can better help with their patients' healthcare needs and their outcomes, doing simple things such as displaying brochures on LGBTQ plus healthcare and healthcare concerns within the community can help the patients feel more comfortable with their healthcare providers and may give them a sense of vulnerability with their primary care physician so they can better their relationship between doctor and patient. Some strategies to increase LGBTQ plus inclusivity in healthcare would be to start with information and education. So in the textbooks, especially college textbooks that discuss health and health assessment and subjects such as those should include more information on LGBTQ health because LGBTQ plus community is primarily only mentioned when acknowledging STIs, HIV and AIDS, um, which consists of so much more, and asking more questions that are gender neutral between the doctor and patient, is proven to be effective, um, and reiterating the fact that um, textbooks should acknowledge LGBTQ health as throughout all of its aspects, not just through STIs.